Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Monday, March 30th. My name is John Bradford. I'm a small business owner here in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives, and I am your briefing call moderator. The purpose of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to update, educate, and support the North Mecklenburg region during the outbreak. Today is day 14 of the President's initiative of 15 days to slow the spread. Obviously, that's not necessarily going away. There are two websites here on your screen, cdc.gov and coronavirus.gov, both very, very helpful, informative websites. Remember, if you're feeling sick, please do not leave the house. Don't go anywhere. Contact your medical provider. If you're an older person, stay home, stay away from other people, etc. President Trump announced that social distancing is now required and as an extension through April 30th. As you can see right here on this screen, the Claremont College has this great graphic, which I really liked. It shows social distancing at 6 feet at all times in public. And you can see the reason we want this is to flatten the curve. You can see the red curve here is without protective measures, and the blue curve is really what we're going for here to try and flatten the curve to minimize the outbreak. Apple, believe it or not, Apple, along with CDC, just released their screening tool. You can go to this website, apple.com/COVID-19, and there is a screening tool. So Apple and the CDC together with the Whitehouse and FEMA launched a new website and app with a COVID-19 screening tool to help you. And you can do this for yourself, or you can use it for someone else. So if you have a loved one that's feeling symptoms, you can actually go through this screening online. The idea being that it's going to help utilize our resources better. And this is a great tool. So I just want to share all that with you today. As you can see, here's the United States heat map. We have over 122,000 cases. This was updated yesterday at 4 p.m., so the number's already changed. We've had over 2,000 deaths here in the U.S. Obviously, this continues to grow. There is a FEMA rumor control website. Here's the address on your screen. I did check. There are no new myths and facts, but I do think one worth mentioning is don't be scammed. If someone is offering you money, the IRS knows your information. You will be eligible for money. If someone is telling you they can get you money, you need to check with some trusted resources. Chances are you're being scammed. So please be very cautious about that. We are still under a state emergency here in North Carolina. Here's the 1-866 hotline number, and you can also text 211 for assistance, or you can also text COVID-NC to 898-211. By the numbers, this was updated 11 a.m. this morning. In North Carolina, 1,307 cases. We've had 6 deaths in North Carolina, and we have 137 people who are currently hospitalized because of COVID-19. And again, this data is from our Department of Health and Human Services as of 11 a.m. this morning. And if you look at the heat map of the state, on the 17th of March, there were 16 counties impacted. Then it went to 22, then 53, 61 on Friday, and today we now have 74 out of 100 counties in North Carolina that are impacted. The governor issued Executive Order 121, a statewide stay-at-home order beginning today at 5 p.m., and right now it's scheduled through April 29th. Please make sure that you understand if the order applies to you, and if you are a parent that needs food for children, you can text FoodNC to 877-877. We still need volunteers in North Carolina, so if you're a clinical support, or if you're a physician or advanced care provider, or even non-clinical support, or if you have medical supplies, please go to this website. North Carolina needs you, and there's a website you can register. Here's a state unemployment website. These are for individuals who've been separated from employment, or if you've had your work hours reduced. And this is also for employers as well. So this is a great website by the North Carolina Department of Commerce for our employment security. Mecklenburg County, we now have 333 positive cases. That was as of just a few minutes ago. And the heat map by zip code is no longer available. They're not making it publicly available. And we did have our first death in Mecklenburg County yesterday. The victim was 60 years old, so our thoughts go out to his or her family. And of course, you can go to mecnc.gov. The stay-at-home for Mecklenburg County is still in effect. Just know that our order here in Mecklenburg County may be more stringent in some cases than the statewide order. The most restrictive order has the authority. That's very important. So yes, there's a statewide order, but please make sure you understand the Mecklenburg County order as well. If Mecklenburg County's order is more restrictive, then that's the one that prevails, or vice versa. You can also get some clarity for real estate. This is something that Commissioner Cotham has been fighting for. Real estate and automobile sales, outdoor activities, and face-to-face contact. You can go get clarity on the Mecklenburg order at the website by going to mecnc.gov, click on news, and then go to the stay-at-home orders clarification and guidance. Now, once again, we have U.S. Congressman Greg Murphy. He's from the 3rd District of North Carolina. He's also a Davidson College alumnus, and he's the only practicing physician in Congress. He's with us today. Congressman Murphy, we'd love to hear an update from you, sir. Thanks for joining.
John, thank you again. This is so good for people to get educated, get something straightforward, cut to the chase. So we have so many constituents that are just, really asking for good information. And thank you for doing this. 2 things. I'll just talk a little bit about what's going on medically. Again, I am a practicing physician. I do speak the language of a lot of physicians. I've been on the phone with infectious disease experts, epidemiologists, scientists for several weeks in this regard. We're in a situation, I think, finally, the vast majority of individuals are taking this to heart. We still are having some pockets of individuals who are not. And unfortunately, their individual actions risk the health and welfare of other individuals. So again, education really is the key. Nothing new. We're still waiting word on finally on the hydroxychloroquine and azithromycin. There are reports that are coming out on both sides of this. It is being used for what we call compassionate use in some instances for individuals that literally they've tried everything else and this is the last straw to see if they can't help. There has been some good activity there, but again, we're waiting on the final word with that. Some other things that we're able to pull plasma, and this was done during the Ebola crisis, pull plasma for individuals who were able to survive and see if those antibodies that those people had naturally are going to be able to use for other individuals to help fight this disease. I think there's a lot of promise for there. Again, the vaccine is still a year away. I want to talk a little bit about what we passed in Congress last week and how it applies to each individual and businesses. Again, very important that correct information goes out. Each individual will receive a check, again, ratcheted depending upon their income level, because there are phase outs. Each individual up to around $99,000 will receive a check for $1,200. A couple will receive $2,400. $500 is payable for children. And so, one couple will be able to get $3,400. It is reduced for higher income earners, starting at $75,000 for an individual, and the phases out completely at $99,000 for individuals, phases out completely at $198,000 for couples. Big questions now are, how am I eligible? What am I eligible to get these loans? Small businesses, less than 500 employees are eligible, 501c3s with fewer than 500 individuals who operate as a sole proprietor or an independent contractor, they still are able to get these loans. SBA.gov is a good place to start, or really with your individual lender is really the best place. So a lot of information. I'm actually going to do a teletown hall tomorrow, but there's a lot of good information out there. And as John said, if somebody's offering you a check or something early, do not believe it. Unfortunately, we have people in the society who will take advantage of this situation. So good, clear, factual information is key. Again, John, thank you for all that you're doing. This is fantastic for the people in your district and really for our state. So again, I thank you and appreciate you allowing me to be on the show.
Yeah, we can't thank you enough, Congressman Murphy, for everything that you're doing for not only North Carolina, but for the United States. So stay safe and healthy, and we look forward to hearing from you on our updates in the future. Thanks again. Before I go to our next panelist, I do want to just, on the screen here, you see we have the U.S. Small Business Administration. We have the North Carolina Director, Thomas Stith. He joins our briefing calls every Wednesday, so he'll be on our next call. But for now, here's the website for sba.gov/disaster, and here's also the loan website, and there's even a hotline. So these are some important details for those of you that may need some assistance from the U.S. SBA. Now we're going to turn it over to Dr. Jack Faircloth. He's a doctor on the ground right here in North Mecklenburg. He works for Holston Medical Group. Dr. Faircloth, would love to hear an update from you, sir.
Okay, yeah, thanks, John. I appreciate all you're doing for our community. Today, it'll be talking about the updates in testing, the new FDA approval for the drugs that the Congressman mentioned, what the status of our local hospitals and local offices are, and tips on how to care for elderly parents, as well as tips for everyone. So first, some exciting news. The FDA did approve a new 5-minute test from Abbott. The great thing about this test that was approved over the weekend is that it will allow our capacity, we hope, by next week, around the nation to increase to around 100,000 tests per day. And that's really unheard of for any country that's fought this virus. That 5-minute test runs on our strep and flu machine, the same machine that we have in doctors and urgent care and ER offices. So the infrastructure is there. We have FDA approval. Now it's supply chain to get it to us. The FDA did approve 2 malarial drugs, hydroxychloroquine and chloroquine. The approval is to use, as the Congressman said, in the hospital, and they're mainly for using on teens and young adults. The nice thing about those, the other update on those is that a 30 million dose supply of hydroxychloroquine was shipped to the U.S., so that's now added to our already existing stockpile, as well as 1 million doses of chloroquine. So those have been added over the weekend. Locally, our hospitals, our offices are open and ready for business. Our volumes in the ER are down by 40% locally as of today. Hospital admissions are down by 30%. So our capacity is there. Primary care offices are open and ready to see you, and we're down by over 50%. So we are not too busy to help if anything happens. Like you said, I want to point out that there has been 7 deaths in North Carolina, which that death rate is extremely low. We rank 19th in the country as far as actual recorded cases, but that death rate is much lower than that. Tips for adults. If you're an adult who's caring for elderly parents, I actually came across an article that said something really wise, which is go ahead and call this parent and ask them for their advice. Ask them how do they want to stay in touch with you. Important to ask is also how often would they like to be called. Ask them what times they want to be called and what method. If it's not calling, maybe they prefer text, email, or other venues. But really just asking parents, remembering they're resilient, they're wise, and asking them is very empowering. And then just to close, tips for everyone. We do know social distancing saves lives, but also developing a routine while you do that in your home is very helpful for your mental state. Try to structure your days. Don't stay in bed. Get up, shower, get dressed. Think differently about doing group activities. Find out what Zoom is and WebEx and how they may be able to help with those birthday parties or events that are canceled. Most of all, stay in touch, not just with your loved ones, but for people that may not have loved ones. Any way of staying in touch is better than nothing. Limit your news intake, and also just maintain the basics. Eat healthy, get sleep, get your rest, and call us if you need us. We are not too busy for you. We have capacity everywhere. Thank you.
Thank you, Dr. Faircloth, and thank you for being on the front line, all your colleagues, everyone in the healthcare community and emergency services. We cannot do this without you, so thank you. Now we're going to go to Mecklenburg County Commissioner Pat Cotham. Commissioner Cotham, we'd love to hear an update from you. Commissioner Cotham, you might still be on mute.
Oh, can you hear me?
Yes, we can hear you now.
Is this better? All right,
Perfect.
Thank you. Thank you for inviting me. I enjoyed listening to Dr. Faircloth. He gave some great advice for us. Well, John, you gave some of the numbers. I want to just kind of go over, and you talked about the realtors and the car dealers. Those two groups are are still struggling to get clarity. And it's part of the problem is that it's just been inconsistent. Before the governor did his part with the state mandate, other counties like Wake County, their rule was totally different for car dealers and realtors, and so it's not been a level playing field. And then it's also when people have called in the last few days to try to get clarity, it depended on with whom they spoke. And so the clarity is the really important right now, because I can tell the car dealers and the realtors, really want to cooperate and do everything perfectly, but it's just hard when the line seems to be moving on to what they're supposed to do. But I mean, that's my goal this week, is to make sure we have clarity on that. But we're not there yet, I can tell you that. I am getting a lot of calls about parks, that people want the parks closed. And I haven't really had a lot of people call me about having them stay open. And I haven't been out, so I haven't seen for myself. I certainly have read about it and listened to people talk about it, and I've seen it on television. And I know I asked the county last week to get some signs up about the playgrounds, about that they were closed. But I mean, again, we have a lot of parks and a lot of playgrounds, and I know they're working toward getting that done, but it's not done yet. And so I do worry about kids on playgrounds, especially. On switching subjects, I'm hearing from a lot of people who don't have access to Wi-Fi, and they are struggling. John, even the things that you get put out, websites and all these things to do and text this, but if people don't have access to that, they are really stuck, and they're just feeling like they're falling through the cracks, and I think they are. And I've really got to push that when I talk with the county manager about addressing this need of people who don't have a smartphone or access to the internet and don't have anyone to help them. I wanted to share with you a little bit of a few sentences from a gentleman who contacted me, and this is exactly what I'm talking about. He told me he was 60 years old, and he said, I have no luck in getting unemployment. He said, the directions keep saying to go to the website. I don't have any way to do that. I don't have anybody to help me. I'm at my wit's end. My spirit is broken. I have no will to live. I suffer from mental health issues with anxiety and depression. I have high blood pressure and a brain aneurysm. I am about out of food. I can't pay my rent. I want a job, not employment. Can you help me? That, really took my breath away when I read this email from this man, and I have contacted him. We've spoken several times, and I'm trying to get him some help and get him some help from his state legislators who, might be able to help him. But I feel like he is representative of a lot of people who are not getting the help that they need. And I don't think we're talking enough about mental health. Dr. Faircloth, talked a little bit about some things in his comments today that certainly will help with our own mental health, but I know we have some people who suffer more, and I'm going to try to focus on that this week. Here's something that probably you don't think about that I want to just talk about a minute, and that's about our prison system. Inmates in prison they have stopped work release. And we have inmates that are from Mecklenburg County and the neighboring counties who are soon going to be released from prison. And when they stop to work release, that means that they won't have any money when they get out of prison, probably sometime in the summer or the early fall. And that I'm getting calls from families and hearing from inmates They don't know what they're going to do. They won't have any money. So that's going to add to our homeless population. Those people will need more services. Up in the university area, there's the only women's work release facility in the state. And there are 30 women there. And basically, we as taxpayers do not pay for their room and board. They pay for their own room and board because they've all had jobs in the county, and they pay their own room and board, and then they get like $40 a week, and then the rest of their money is banked for when they get out. But now the prison system has stopped that, so those women are just sitting there, and it's very likely that the prison system will call them back to finish their sentence in the prison. So that's just something that probably none of you might not know about, but I've been out to that facility numerous times over the years, and that they're really making a difference in helping people transition back to society. And the last thing I want to mention is our next board meeting will be on April 7th, and we are going to use WebEx to have that board meeting. And so this week, the county commissioners are going to practice a little bit using that tool. So I wish us luck on that. So that's my report. Thank you, John.
Thank you. Thank you for all you're doing. And I know the realtors specifically appreciate your help, as do I. So thank you. Moving now to Cornelius Mayor Woody Washam. Woody, an update from Cornelius would be appreciated.
Okay, thank you, John. Again, thanks for coordinating this. I want to sort of dovetail on something that Pat brought up, which I have some great concerns about as well, and that's the clarity over a couple of these industry types, if you will, the car dealers and the realtors. Thank you, Pat, for driving that train for us and helping us bring that clarity. I know it came up in a conversation with the EMS group this morning. I still don't think any clarity came out of it. There was not a lot of conversation about it beyond my town manager and Mayor Aneralla. So we just got to get that straightened out for these groups that are trying to hang on at this time. So thank you, Pat, for your help on that. In addition to that, we had quite a weekend in Cornelius with our 75 miles of shoreline. It was more than active on a beautiful weekend. I had some high-level concerns about what was going on at the lake. I think our lake patrol did a really, really good job in trying to educate our population that was out there, trying to have fun in these kinds of times. And but we did have some folks that were gathering in larger groups on the lake, and so we're going to start with this education, and hopefully that will take hold and fix this problem, going forward. It is a concern of mine as well. In addition to that, my really only instructions to folks has been, if you see issues like that happening, dial 311, and you can provide those reports, and they will actually notify the appropriate jurisdictions. Well, I think that 311 number had some problems, Pat. I'll give you that little feedback as well. This past weekend it was busy. It was probably overloaded, particularly on the Saturday and Sunday afternoon time frame. So we really need to have that thing working so folks can point out where they see these problems, because our public safety folks just can't be everywhere. In addition to that, Cornelius appears to be in the 4 to 6 confirmed cases category. Anything over 0 is too many for me, but that's where we are right now. From the information I have, I'm very grateful that the county medical director has agreed to put out those statistics again by zip code. I think it's just kind of important that we know. So I'm grateful to her for doing that. Also, our park department, our parks were just overwhelmed this weekend. They are distributing a weekly newsletter now, and they'll be putting out some things daily on social media, which will provide ideas of how to stay active, how to we'll provide some tips on how to help sort of beat this situation we're going through. And some people refer to it as boredom, but we're just not used to staying at home in this country anymore, particularly in this beautiful lake area we have. So hopefully that'll help, and hopefully folks will tune in and take some advice from it. Thank you.
Thank you, Mayor Washam. Now moving to the town of Huntersville, our mayor, John Aneralla. Mayor, we'd love to hear an update from you from the town of Huntersville.
Hey, John, thanks for having me, and I can only reinforce what Commissioner Cotham and Mayor Washam have stated. We need to be consistent, I think, throughout the state. I understand, we're an urban county, but I would encourage our county commissioners to talk through with county manager and the emergency people to try to get clarity on what can be done here in Mecklenburg County as opposed to what can be done just a mile or so away in Iredell, Lincoln, or Cabarrus. I'll reiterate also behavioral health. I don't think a lot of people are talking about it. If you feeling you need to talk to somebody, I have a number, 704-444-2400, 704-444-2400, and also toll free 800-418-2065. Just if you need to talk to somebody. Also, we need blood. There are remote blood drives, either through Atrium or American Red Cross. So I'd encourage people to do that. You don't have to go to the hospital for that. They have remote centers. Interesting, Charlotte Motor Speedway is also a testing center now for the coronavirus. So we're might not be racing cars there, but they're testing. And then finally, just to can give everybody a sense of what's going on with our first responders. 32 of our first responders have the coronavirus right now. So if you're in need of emergency, either through the police or fire, please tell them in advance. If you can remember, please tell them in advance to take additional precautions. So the only other thing I'll tell people that are listening or watching, please be patient and use common sense when you're out. Whether you're going to Lowe's or the grocery store, just be real mindful of your presence and where you are relative to others, and just be patient and look for the signs that many of the retailers have in terms of where you should stand when you're checking out, or just keeping your distance from everybody, so we can get through this sooner rather than later. So that's all I have.
Thank you, Mayor. I appreciate your leadership in the town of Huntersville. Let's see, Davidson Commissioner Matthew Fort was going to try to join. Commissioner from Davidson, are you on by chance? Commissioner Fort, anyone from Davidson? Final call for the town of Davidson. Well, we continue to reach out, and we'll leave an open invitation to Davidson, but unfortunately we haven't had anyone able to join the call. So we're going to move on now to Charlotte Mecklenburg Schools. We have District 1 board member Rhonda Cheek. I know she's on the line. Rhonda, we'd love to hear an update from you on all the good things that are happening at CMS.
Good afternoon, and thanks for having me here, unfortunately, under these circumstances. So just a few quick updates. There's a lot of things kind of pending right now because of the State Board of Education meeting that they had on Friday afternoon that we're still sorting out. But the first thing I'll say is we are feeding kids. We are feeding kids at 70-something school sites, plus we're doing meal deliveries in the North Mecklenburg area. If you know of a family or that is in need of nutrition for their children, please call our CMS nutrition number at 980-343-6041. We're serving over 22,000 meals a day right now. We feel that as the unemployment rate continues to grow and more people are out of work due to the virus, that number will continue to grow, and we want to continue to serve the needs of this community by feeding our children. So that's just one of our top things. Ada Jenkins and several other community agencies in North Mecklenburg are assisting us with this, and we're very grateful. There is a North Meck delivery bus right now that's coming around. Secondly, so the state board made some pretty big decisions on Friday, one of which that we were going to be allowed to launch new learning and have that new learning be counted on April 1st, which is Wednesday. A lot of our schools were ready to roll this morning, so I think that they're doing that. The biggest issue we have is to make sure that every school is ready and every student has what they need, and we're still working on that. We've got a big variety across our county of degrees of readiness. At some schools really still struggling to get technology in people's hands and get information out, but we have a lot of schools that are ready to roll, and they're already beginning. There was some very interesting information about seniors. I'm not going to share a lot here because I'm still sorting it out as a parent of a senior and as a board member. Basically, they said that the seniors, they're going to count their second semester grades as of the end of the third quarter, the day that school got out. Basically, wherever they were, they're going to do a pass-fail. We're still kind of sorting out how that impacts our kids. Kids are going to be notified where they stand, but we're encouraging kids, just because of whatever they have coming next in their life, whether it be college, military, or career, you can stay engaged with your classes. You may not have to take the test, you may not get a grade, but we encourage them to stay engaged with their classes, particularly our students in AP learning. They do have AP exams that are going to be online. That's all on the College Board website. And all that is still going to be happening. So we are encouraging our seniors to stay engaged with their schools for many reasons. Just as Mr. Aneralla mentioned, the mental health needs, the social and emotional support that kids can receive from being engaged with those classes, we think will make a big difference in how they weather this next 4 weeks of isolation. So we're concerned about our kids, but any parent that has any concerns can call, get on the CMS website, or call the schools. We are running skeleton staff in a lot of our schools, and the phones are being monitored from home. So we've just got a lot kind of moving. We'll be probably having an emergency board meeting electronically tomorrow or Wednesday to discuss more of this and more of the leave information for staff. So that's where we are today.
Thank you so much, Rhonda, for that update, and we're happy that you're on our briefing panel here, so thanks for joining. And now we're going to go to the CEO of the Lake Norman Chamber of Commerce, Mr. Bill Russell. Bill, would love to hear from you from a chamber perspective.
Thank you, John. As we discussed on Friday, we had a great Focus Friday. It's sort of long, comes in right at an hour, but if you go to our website, you'll see the Focus Friday was the regional business approach to COVID-19. We had it moderated by Jeff Tart, and the panelists included Dina Diorio, who's our Mecklenburg County manager, Mike Riley, who's the president of our Huntersville Medical Center here in town, Eileen Joyce, who's the marketing outreach for the U.S. Small Business Administration, Kenny Colbert, who's president and CEO of the Employers Association that works with a lot of our larger corporate members, particularly their HR departments, and then myself. And again, you can go to lakenormanchamber.org and see that presentation of Focus Friday. A little bit long, but you can it's got some great information, and you can scoot along the website and see that information. On April the 2nd, this coming Thursday at 9 o'clock, we're going to do a program on the Families First Coronavirus Response Act. It's the Coronavirus Aid Relief and Economic Study Act, and what business owners really need to know and what you need to do. Jay Leisman, who is a CPA here in town in Huntersville, he is going to be leading that discussion. It is going to be Zoomed, and we will take RSVPs, and so folks who are on Zoom can ask questions live. It will be taped, and then we're going to rebroadcast it via YouTube and send it out via email and social media. On April the 7th, we're going to have our regularly scheduled Business Works program, and it will be a stimulus presentation by Dale Gilmore, who's with Quest, and Dale is going to be speaking to that. A lot of things still going on in the Chamber of Commerce, most of them virtually. We continue to ask folks to support our restaurants. When you have an opportunity, please eat out, get some delivery or takeout from our restaurants. I just had lunch at Honey Baked Ham Company. It was absolutely delicious. There is a list of restaurants on our website. We have our chamber member restaurants at lakenormanchamber.org. But Visit Lake Norman has gone through and put a complete compilation of all restaurants in Cornelius, Davidson, and Huntersville, and they're updating that on a very regular basis. Again, a lot of our retailers are still operating via the website, so you can get some fantastic deals and support these businesses. And as we've said every time, we're going to get through this. We're still in the middle of it, but we'll get through it, and we'll start carrying on the business of Lake Norman. But thank everybody for supporting our restaurateurs.
Thank you, Bill, for that update. Much appreciated for what you're doing for our business community. We continue just to have an open invitation to Huntersville Chamber. Here's their website. The last report we had was that their members are working together to help other members, and so there's a website here you can check out. Our next briefing is April the 1st, which will be Wednesday. Lake Norman is stronger together. The North Mecklenburg area is stronger together. I wish each and every one of you to stay safe and healthy, and I appreciate you listening. And if you have any questions or anything you want to send us, please email lkntogether@gmail.com. That's lkntogether@gmail.com. This does conclude today's briefing, and we'll talk to you on Wednesday. Thank you for listening.